Good evening and welcome to the Fort Hall Forum. My name is Susan Scher and I'm a member of the Board of Directors of the Forum, and I'm the moderator for tonight's event. Tonight, National Abortion and Reproductive Rights Action League President Kate Michelman joins us to discuss how we can lessen the need for abortion in our country through educational and legislative efforts. Before I introduce our guest for this evening, I'd like to take just a moment to tell you a little bit about the Fort Hall Forum. Since our inception in 1908, the Fort Hall Forum has been offering the greater Boston community an opportunity to hear the views of men and women who are shaping our community, our nation, and our world. Now, over the past 86 years, the Forum has presented hundreds of speakers whose ideas span the political spectrum, everyone from Margaret Sanger to David Duke. Each program has offered the public a chance to question, challenge, and react to the views presented at the Forum. This is interactive at its best. We are committed to making the Fort Hall Forum accessible to the community at large, by offering programs that are both open to the public and also free of charge. But this has a cost, because rising prices make continuing our tradition of free and public debate a very big challenge. And this can only be met with your support. So this is the pitch part. Forum membership is open to you, and you can go over to the table after tonight's event, find out about the rest of the programs for this season, and please pledge your membership and give until it hurts. Tonight's program is in honor of Frances Smith, an outstanding board member and committed to the Fort Hall Forum. And now on to tonight's program. During her 8 years at the helm of the National Abortion and Reproductive Rights Action League, Kate Michelman has seen NARAL's membership grow to 750,000 people. Under Ms. Michelman, the League has established itself as the political arm of the pro-choice movement and has been a force in the election of pro-choice office holders nationwide. With major victories now behind them, Ms. Michelman has led the effort to broaden NARAL's mission to include not only fighting for choice, but also supporting policies that will make abortion less necessary. This is by reducing the number of unwanted pregnancies, and they will include human sexuality education, contraceptive research and dissemination, teen pregnancy prevention, family planning services, prenatal care, family leave, and child care legislation as a part of their mission. Now, prior to taking over NARAL in 1985, Ms. Michelman directed Planned Parenthood in Harrisburg, Pennsylvania, and she has worked in developmental child psychology and reproductive health. And now, to discuss the policy goals of the pro-choice movement in the coming years, and you might wonder what they'll be like, I'm pleased to present Ms. Kate Michelman.
Thank you very much. I must say it's an extraordinary honor to be in this very historic site and to know that Margaret Sanger spoke here. I was told the little story, I don't know if you know the story about Margaret Sanger, and the city did not want her to speak, and they told her that she would be hoisted away. That's probably a bit of an exaggeration, but there was an injunction against her speaking, so she showed up and taped her mouth, and the senior Arthur Schlesinger read her remarks. That's an incredible story. So much for that era, and here we are in 1994, and it's a much freer society, thank goodness. So thank you for coming tonight, and I'm looking forward to talking with you about what I believe to be the necessity of the pro-choice movement to engage in a wider vision. 25 years ago, NARAL was born into a very, very different America. Women were dying in back alley operating rooms. Abortion was a crime in almost every state. Equal rights for women a threat. Those were the early years before Roe versus Wade, the days when NARAL was the only group totally devoted to making abortion safe and legal. The last quarter century has seen a lot of turbulence and a lot of change, from women dying in the back alleys to the Supreme Court's decision legalizing abortion, from a movement that struggled to be heard to a pro-choice majority marching and voting to protect our right to choose, from 12 years of anti-choice policies to the election of a pro-choice president. I often look back at our continuing struggle to hold on to Roe, the marches, the court appeals, the violence at the clinics. I look back with a measure of anger that we have spent so many years fighting a battle we shouldn't have had to fight. The battle to give women in this country the simple right to make the difficult decision about abortion. Like other battles for justice in this nation, for suffrage and for civil rights, this battle shamed America, but ultimately it made us stronger. Our victories, when they came, were sweet, but fleeting. We still today wake up the next morning to find the ground we'd won slipping away. We're back in court, we're trying to head off new threats from the state houses and at the clinics. And we still watch women who most need our help, the poor, the rural, the young, denied their right, still today, 1994. And all the while, we run against a darkening shadow of too many women facing the difficult choice of an abortion, too many unintended pregnancies, too many unwanted children. Fully 57% of all pregnancies in the United States are unintended. Each year, about 1 million teenagers become pregnant. 80% of those pregnancies are unintended. Half of the teens give birth. Each year, the federal government spends an estimated $25 billion on families started by teen mothers. Each year, 300,000 low birth weight babies are born and 35,000 infants die. Compound these tragic statistics by inevitable poverty, crime, and illiteracy, and the cost goes far higher. Add lives without opportunity, without hope, and the nation's shame widens. We've lost too many already, at a cost that no amount of money can reverse. And unless we turn life around for millions of our kids and their families, we're going to lose a big part of the next generation. I just want to stop for a minute and read to you, in connection with what I'm saying, just a paragraph or two from the report in the New York Times on Tuesday. The Carnegie Foundation, the Carnegie Corporation just released a 3-year study of young American children that confirmed some of society's worst fears. Millions of infants and toddlers are so deprived of medical care, loving supervision, and intellectual stimulation that their growth into healthy and responsible adults is threatened. The report paints a bleak picture of disintegrating families, persistent poverty, high levels of child abuse, inadequate health care and child care of such poor quality that it threatens youngsters' intellectual and emotional development. The report says that this is a result of many parents being overwhelmed by poverty, teen pregnancy, divorce, or work. Now, how do we respond to this crisis that spreads around us, that knows no class, no color, or neighborhood? The answer must be the pro-choice, and indeed, I believe, America's vision into the next century. We at NARAL have spent the last 25 years leading the fight for one right, the right to choose abortion. We had to make that fight, and it's far from over. But now it's critical that we do even more, that we must lead the fight to make abortion less necessary. We must wake the nation to the broader truth that reproductive freedom is not just whether or not to have an abortion. Genuine reproductive freedom requires the ability to make informed, meaningful, responsible decisions about sexuality, contraception, pregnancy, childbirth, and abortion. Simply put, that means waking America to the crisis in reproductive health, making reproductive health a cornerstone of our domestic policy, convincing our young people of the risks and the responsibility of sexual relations and pregnancy, making healthy, strong, loving families a personal triumph, cherishing all of our children, making our most vital family value the raising of children who are valued and loved. Every single time you hear about a desperate mother abandoning her baby, about a grim tale of abuse or neglect, or about a teenager who believes she couldn't get pregnant or get AIDS the first time she had sex, it means, among other things, that we have failed to take human sexuality and reproduction seriously, to develop the self-esteem and to instill values that make families healthy and our society strong. Changing attitudes about all of these things, transforming the way Americans think about these issues, will not come as easily. It will take sharp and I think sometimes painful debate. It will take a public that has shrunk from these issues to confront them, to wrestle with the crucial responsibilities involved with sexuality and reproduction. It's going to mean opening America's eyes, changing our mindset toward women, sexuality, and childbearing. It's going to mean facing the stark realities of teen pregnancy, of too many unwanted children, and the terrible, terrible cost of continuing our neglect. It's going to mean reassessing and reordering our values, taking reproduction seriously, teaching responsibility, valuing our children, understanding that the very soul of this nation, the endurance of our freedoms, depend on how well we prepare our children to make the right choices, to have them believe that theirs will be a better world. Many of them do not. Just consider the value we put on sports or entertainment or mall shopping for that matter, all the time, all the billions, and wonder what our world would be like if we put just a fraction of that value on bringing up sexually responsible young adults. And if anyone thinks we have passed these values on to our children, explain then the tragic statistics of unintended and teen pregnancies, infant mortality, and low birth weight babies. If anyone thinks we have sound reproductive and sexual health policies in this nation, explain why we leave so many children to flounder with their own sexuality, or the broken promises of health care that leave so many women and children at risk, uncertain about access and fearful of cost. These are the pieces of society's neglect, the rusty fragments we once called values in this country. Now, the challenge that we face is to help this nation pick up the pieces and weld them into a framework of coherent policies that guarantee every young person the tools to make responsible choices, and guarantee every woman who chooses to have a child the right to proper care and respect. I don't believe it's too late to assemble reproductive policies that confront the grim truth that unless we can prepare and nurture strong families and make every pregnancy desired and healthy, we will forfeit a just society. This study is not new, the information, to those of us who've been in the field of child development and reproductive health. It's not new, but it is stark in what it says about what has happened over the last 25 years. The problems have gotten worse. When I was involved in child development work, 25% of all births were to unwed mothers. In some places in this country now, it is over 50%. This report should scare us to death. The worry I have is it's just a report. And I hope it doesn't just sit on somebody's desk like many others have. What we have to think about is how do we do something about this? We've got to make sexuality education a reality. We've got to change our minds about contraceptive information and clinic inside schools. We've got to grasp and accept the need for comprehensive prenatal care. These are the things we must fight for in Washington, in our state legislatures and local boards. But all that government can offer amounts to little if each of us isn't brought up to take responsibility for our own choices. Our daughters, our sons, our sisters, our brothers must understand that their decision to have sex carries far beyond the moment. They must understand that sexual activity leads to pregnancy. They must understand the cost, the sacrifice, the constant love demanded to raise a healthy, secure child. They must understand the cruelty and sorrow of bearing a child into a family without the ability or the time to care and nurture. That means giving people the wherewithal to make meaningful and responsible decisions. If we as a society do not take reproduction seriously, if we do not understand our own sexuality, if we don't have access to contraception and a healthy sense of the consequences of our decisions, then we have no excuse to rail about teen pregnancy or the high number of abortions. You cannot expect people to exercise personal responsibility if they do not have the information and the tools and the means to exercise personal responsibility. Reducing abortion, holding people responsible for their choices. If anyone thinks they hear the echoes of the far right's rhetoric in my remarks, I ask them to think again. It is true, I believe. We both see these needs as fundamental to our society, and we both believe the country is running out of time. But sadly, our philosophies on how to achieve these goals are vastly different. The far right offers solutions based on punishment and pain. Our answers are based on compassion and respect. Their way often is to denigrate and punish women. Our way is to respect and support women. The outcome of the struggle between these two approaches, I believe, will tell a lot about America over the next decade. The far right did not create the reproductive crisis we face in this nation, but they're doing everything in their power to be sure that we don't solve it. In their America, the way to reduce abortion is to make it impossible or make it a crime. In our America, the way to reduce abortion is to make it less necessary, not more dangerous or difficult, but less necessary. In their America, human sexuality is best hidden by mystery and shame. In our America, sexuality must be understood as a profound and important change in every young person. Their way is to eliminate public funds for abortion, to lock out poor and rural women who face unintended pregnancies. Their way is to make abortion a stigma, something shameful, something fearful. Their way is to assault Roe far from the Supreme Court. Today, most of our state legislatures support some form of anti-choice legislation. These are what I call the Jim Crow laws of the 1990s, local laws that skirt fundamental freedoms guaranteed by our Constitution. They're the modern-day literacy tests and poll taxes. Our work to elevate responsible childbearing is constantly being undermined by the far right. They're running well-financed campaigns for school boards, for hospital directorships, for library committees, for the state houses. Now, why do they want to get onto school boards and library boards? It's to control what our children are exposed to in terms of sexuality education and materials. Why hospital boards? So they can vote out reproductive health services. Not too long ago in Indianapolis, Indiana, 7 community hospitals voted to eliminate all abortion services from their service delivery system. 7 community hospitals, and they were contemplating, I do not know at this moment whether they have decided or what they've done, but they were contemplating eliminating family planning services as well. Just look at the success they have had in Michigan, where they've managed to ban state funding for abortion, a state where births are soaring among poor women and teenagers, those least likely to get prenatal care, those most vulnerable to poor health, high-risk births, and infant mortality. They're blind to the studies that document the obvious, that kids who grow up in families without love are often destined to raise families without love. The kids who grow up in violent families are very often destined to become violent, and so on and so on. If a nation's policies reflect a nation's values, then healthcare reform offers the greatest opportunity we've had in decades to make families stronger, women healthier, and children whole. No right is as crucial to a woman's reproductive decision-making than her right to health care. Federal legislation that's now before Congress that you've heard so much about holds enormous promise and enormous dread. Once again, NARAL and the pro-choice community are forced to return to the field of battle we know so well, to defend a right we keep thinking we've won, the right of women to decide to have an abortion. Once again, the extreme right is trying to block coverage offered in the President's health care reform proposal. There is a terrible danger that the negotiation and the bargaining going on right now in Washington will come at the expense of women's health. We cannot let that happen. We cannot let lawmakers bargain away women's health care. When they bargain away women's health, they bargain away children's health in the process. And let me explain a little bit about why I feel it's so important for the health care reform proposal to understand that reproductive health for women is primary health care for most of our lives, and that reproductive health can't be divided among women as if there's a group of women over here that uses contraceptives, and then there's another group here that needs prenatal care, and then there's another group over here that may need abortions, and then there may be another group that addresses infertility. Many women face all of these issues sometime in their reproductive lives. You can't divide us like we're different people. Reproductive health needs to be seen along a continuum. It's necessary for us to have reproductive health if we're going to be healthy, and reproductive health has to be understood comprehensively. And that's why I believe that the health care reform proposal cannot be allowed to divide reproductive health into pieces and say, well, this service is for these women and will not be included, and this service will be all right. And family planning and pregnancy termination are up for grabs, among others. We need a plan that ends the shameful neglect toward women's health that has long characterized this nation's healthcare system. We need a plan that ensures access to comprehensive reproductive health services, including family planning and abortion. Today, 2/3 of private health insurance plans routinely cover pregnancy termination services. Our opponents want to take that coverage away. They want the government to decide which women can have abortions and which women cannot. Currently, that is what happens in Washington year in and year out. Our Medicaid policies have an amendment called the Hyde Amendment, which disallows funding for the option of abortion if a woman believes that that's what she needs. It's the most discriminatory policy, certainly one of the most, if not the most, discriminatory policy I believe this nation has. To single out poor women and for the government to reach into their health care plans and say to those women that if you're faced with an unplanned pregnancy, that option will not be one that you're able to exercise. We must remind lawmakers that health care reform is our nation's chance to change course. Not only to respect a woman's right to choose, but also to make abortion less necessary through prevention, contraception, prenatal care, and family planning. And we must make up for more than a decade of lost time in contraceptive research. Compared to our neighbors, we're living in the dark ages. American women have fewer contraceptive options than women in other industrialized Western nations. We must break through the Reagan-Bush barrier and give people wider, more humane, more effective choices. We need research and development to provide contraception that is effective, easy to use, and prevents pregnancy and sexually transmitted diseases. In 1980, we used to be the leaders in contraceptive research and technology. Today, we have fallen almost to the bottom, where France and England and other countries are way out ahead of us and have approved methods that we don't have any access to as American women. We also need male contraceptives. And part of the reason why the companies in this country have stepped back is, one, the Reagan-Bush anti-reproductive rights policies, and the fact that we're such a litigious nation that they don't want to engage. But it has put us as American women at a disadvantage, and it has lessened our ability to prevent pregnancies that we don't want to have. For those women who choose to have children, we must guarantee complete access to prenatal care, treatment for drug dependency, child care, and support for low-income families. It is a national scandal that American babies die at higher rates than babies in almost every other developed nation, and that we are experiencing a resurgence of preventable childhood diseases. We need federally mandated care for those who need prenatal services the most, those who are the least likely to get them. We've got to give young families the security of adequate medical care at a minimal cost. No inequality is more starkly drawn than the inequality of health care. No fear and despair is as sharp to a woman as not being able to care for her sick children for lack of money. If health care offers security, then education, I believe, offers hope. I think the government, at all levels, needs to set an example for the nation's school systems in bridging the terrible gap between human sexuality and reproduction. We cannot treat sex as a dirty secret, a forbidden delight, an act of guilt. If we cannot allow America to remain immature and ashamed. We must tell our children that sexuality is a normal part of life, but involves serious responsibilities. We must convince all families to discuss the joys and risks of childbearing and the terrible penalties that young people pay if they are not prepared. For most children, that process begins at home. What a difference it would make if every parent taught these critical lessons. But for too many, millions of our children, these lessons never even begin. These children are allowed to wander through their early years, the victims of silence and myth, then on to their formative years, radical physical change, peer pressure, and the profound complexities and contradictions of sexuality. We must begin to educate our children, all of them, to the decisions that revolve around sexuality and reproduction. We must set national guidelines that begin age-appropriate lessons in kindergarten and take them all the way through high school. Now, I don't want you to hear me saying that I mean teaching the mechanics of sex to small children. That's not what I'm talking about. It does mean teaching teenagers the consequences of sexual relations and the responsibility that goes with taking such a step. That when you have sex, you can get pregnant, become a parent, get AIDS. One area where we agree with our opponents is that abstinence is an important part of sexuality education, but we do not believe that abstinence can be the only lesson taught. Because those who will not abstain must learn about sexuality, about reproduction, about the consequences of sexual activity, about contraception, and about choice. Shame on us if we think it's enough to get 10th graders to look at a few visual aids and then warn them to either abstain or to go out and get some condoms. Just look at the numbers of sexually transmitted diseases, AIDS, teen pregnancies, and abortions. Our obligation must begin much earlier, to teach not just what's happening to their bodies, but the pressure they face beyond the schoolyard. To teach that rewards really do follow a good education. We need to teach adolescents not just about sex and birth control, but about human relations, the joy of love and the dilemma of choices, and the sobering responsibilities of parenting and the economics of raising a healthy family. More than anything, I believe it is going to take a more concerned nation and more dedicated, involved parents. No amount of social drafting, no amount of money can make up the difference for that. But if we don't have those people start out as positive parents, parents who are feeling confident in their ability to manage a healthy family, then we already fail from the very beginning. We're not starting back soon enough. We're arriving at the place that the Carnegie Foundation is talking about. Now, in terms of abortion, we must all continue to make the daily fight to defend a woman's right to legal abortion and to ensure that women of all income levels, no matter where they live, may have access to this important option. But we must give choice a wider definition and assign ourselves a wider mission. We must restore abortion to its proper context, along a continuum of reproductive decisions that women make. It is not the only decision women make, and it's been taken out of the context of other decisions, reproductive and others, that women make, and it's set aside, and we have focused on it like a laser beam for all these years. I think it's time to put abortion into the context of other reproductive and important decisions that women make. And we must address the social, economic, and political conditions that inform women's reproductive decisions if those decisions are to be truly meaningful. Let me give you an example of what I mean by that. There are many women who find themselves with a pregnancy they did not intend. Then they confront the reality of having no health care. These are women who are just poor enough not to be able to afford health care, but not so poor that they qualify for Medicaid. They're in that sort of group, that 40 million people who just don't have health care for one reason or another. They can't afford it. So they're faced with, how am I going to afford prenatal care? How am I going to afford child care, health care for my child? And then you also look at the condition of having a country that has no child care, really no effective quality child care program or commitment to it. So here you have this woman, and she's confronted with this dilemma. And the circumstances of her life say to her, I cannot have this child, and she has an abortion. She may not have had the abortion had the social and economic supports been there. On the other hand, you might have a woman who faces an unintended pregnancy, knows that she is simply, out of responsibility for herself and her family, simply not capable of carrying another pregnancy to term and bringing a child into the world. But she's poor and on Medicaid, and she cannot figure out how to get the $200 to have an abortion. So she ends up having a child. Against her real intentions or will, she has a child. What I'm trying to do is just illustrate how the conditions surrounding women's decisions are issues that we need to address, as well as the choices and the right. We need to address the conditions that inform those choices. We are about choice, prevention, family planning, and healthy childbearing. Pro-choice is not pro-abortion. Indeed, abortion raises serious moral, ethical, religious, and philosophical questions. The issue is who decides the answers to those questions. We believe only the woman can answer those questions and decide. Now, abortion laws must reflect a woman's right and need to make reproductive health decisions free from government coercion. But abortion laws also must recognize women's and society's responsibility to create the conditions for women to bring life into this world. The community's reverence for life should be expressed through its support of social and economic programs for women and children. Prenatal care, parenting support, quality child care, those would be demonstrable reflections of a society that says we welcome life. Instead of trying to take away the right of choice from women who face crisis pregnancies, let's create the conditions for life, and let's try to make abortion less necessary. And to those thinking Americans who belong to no extreme, yet are troubled by the right to legal abortion, I can disagree with your belief, but respect your concern. Because in the end, in our own families, in our own ways, we must all live with the burden of an unintended pregnancy. Where we do agree is the right of our children, all of our children, to grow up safely and responsibly in America. The only way we can guarantee that dream is to make reproductive health a cornerstone of our nation's domestic policy, to make certain the choices and options, and to make clear the consequences. 25 years ago, NARAL stepped forward with a vision of America, where abortion would be safe and legal. Today, we step forward with another vision of America, where reproductive and sexual health are taken seriously, where personal responsibility is a goal, where choices and decisions are respected, where families are healthy and strong, and where children are valued and loved. America must recognize the critical importance of reproductive health, the risk of continued neglect, and how society gains from thoughtful, responsible sexual and reproductive decisions. We must all make it our mission in the years to come to awaken and educate this nation to the reproductive decisions that precede abortion, and to assure women that those decisions will be theirs to make. Our vision is that fewer women face unintended pregnancies, that there are fewer abortions, fewer teenage parents, fewer people infected with sexually transmitted diseases, fewer babies born too early, too small, and too sick. We must protect and secure reproductive choices, choices that today are not given equally, choices that make the difference between security and despair, choices that are the measure of a truly just society. Thank you very much.
Thank you very much, Kate. And now this is the portion where the audience gets to participate and to ask questions of our guest. I'd like to suggest to you that you should come to the microphone, because this will be cablecast and also aired on the radio, so we want to be able to hear you. I'd like to reserve the right to ask the first question, if I may. You mentioned the National Health Program and including reproductive rights. There is a concern from political activists like myself that we won't get national health care if reproductive rights are included in the health care Clinton plan, because the radical right will make sure that the entire health care proposal goes down if reproductive rights are included in it. Do you have a comment about that?
Well, I do think there is an enormous danger of that very thing happening, that the health care plan will be held hostage by the extreme right that wants to discriminate, or maybe their intention isn't to discriminate against women, but the ultimate result of their policy, which is to eliminate family planning and abortion services out of the health care plan for women, will actually end up discriminating against women. And I think there is an enormous danger of that. We worked very hard to ensure that comprehensive reproductive health was in the plan. It is in there. And now it is up to all of us, each and every one of us, to make sure that our senators and representatives understand that we know that there is a serious crisis of reproductive health in this country that is demonstrated by the lack or the high rate of unwanted and unintended pregnancy and all the other statistics that we've talked about, and that we insist that comprehensive reproductive health, from prevention to prenatal care to abortion, is part of this plan, and that you all and we all need to take some responsibility, because I want to tell you that if it is eliminated, if family planning and/or abortion services are eliminated, it will, over the long term, force women once again to resort, in the state of a crisis pregnancy, to an unsafe method. I'm not trying to be sensationalistic here. I don't think it'll happen overnight. I think over the long term, because once again, pregnancy termination services will be isolated and separated out from other reproductive health services. Fewer and fewer doctors are already performing the service for women who need it because of the violence and the harassment and the threats that they receive from the extremists. If you isolate the service from other reproductive services, it will further exacerbate that problem of doctor shortages. And over time, we're going to see more and more women have to resort to less safe, perhaps very dangerous methods. Most importantly, however, it is time for the discrimination against women's reproductive choices to end as a national policy in our nation. But if we don't organize our voices and direct them to our legislators, the other side is very well organized. They are unleashing a major campaign, already running newspaper ads, threatening members of Congress, threatening to hold up the whole plan. Well, I don't think we should have a plan that discriminates against women's health needs in this country. Because when you discriminate against women's health, you're discriminating against, well, it's just unacceptable. And it ends up hurting children as well, because women's health, family health, is all part of the whole. So I have to say that the answer I must give is that I have to ask us all to not let this happen, because instead of moving forward to stress prevention and healthy childbearing as well as respecting choice, we will take a step backwards. Women will lose coverage they already have. We'll once again be in the battle for our lives for women, and I want us to get beyond this. So,
thank you. Yes, sir.
Tell me if I'm oversimplifying, but this is a very complex issue, it seems to me.
It is.
With a moral component and a financial component.
You're right.
There's dispute on the moral component, but I gather you and everyone else agrees that the financial component is intolerable. It's
when you say the financial component,
the cost of the unwanted pregnancies, the cost of billions that it costs America to terminate or otherwise deal with pregnancies. In other words, the financial cost is something that, or maybe you don't agree that that's it's
what's
skyrocketing.
Your question?
My question really is, I get the impression that you feel that society has a responsibility to not only approve of, but continue financing sex.
Oh.
Even unmarried sex, and the consequences, whereas, and the financial consequences of that, basically. And it occurs to me that before 1961, there really wasn't a problem when society didn't have that responsibility. It was the problem for the girl, for her parents, for her boyfriend, and there was, I think, as I understand it, much less unwanted pregnancy. Now, the problem...
Okay, sir, why don't you let her answer the question?
Okay.
Well, there've always, by the way, we should not be fooled here. There've always been there's always been unintended, unwanted pregnancy. There's always been teenage pregnancy. Yes, it's risen, but there's always been. The reasons for the increase are complex, and you started out by saying they're very complex.
But the cost used to be internalized. Now it is financed by
the costs, no, not necessarily. I mean, that's a fallacy also. The costs were internalized. Society has always paid costs when a family has, when a woman who was not able to care for her children was faced with not being able to care for them. The society is always. If you're saying the families used to bear that burden, yes, to some degree, but society always paid a price. I want to say that I'm certainly not sitting here saying I'm interested in financing sex. What I'm interested in is society recognizing that we have an enormous problem here. We have children not knowing how to make responsible decisions about sexuality because our nation has trouble talking about sex. We separate it out, just like we separate abortion out and put it over here. Never do we think about integrating into our children's development, human development, and sexuality development, so that, and parenting education, so that by the time a young person is faced with the pressures of hormonal change and adolescence, they are not prepared to handle those to handle those pressures well. And I think we have a responsibility to face up to this and to take it on. It would be wonderful if we did it well as parents, but we can't. We don't. I said it in my speech, I'll say it again. Millions of kids are wandering through their lives not knowing how to make these decisions. And I think it's irresponsible of us. Other countries don't have high teenage pregnancy rate like we do. They don't have the high rate of abortions that we have. And we have to look at why. They're not having sexual intercourse less often than we are. That's not the issue. The issue is that the country has even written in its laws, we will provide education and access to health care that ensures that prevention of pregnancy is a goal or is a value. And it results in fewer teenage pregnancies, fewer unintended pregnancies, and fewer abortions. It is going to take a combination of government and private funding to address some of these problems. I'm not advocating a wild-eyed sort of government funding, but I also, when you look at this terrible report, we can't ignore it any longer. We're not doing something right. And I don't mean just throw money at it. I mean, let's change the way we think and change the approach altogether.
Next.
That statement you made about the country running out of time, I agree with that 100%. I don't think we have much time left at all.
We do not.
So what I wanted to ask you, one thing we could get mad about, I suppose, they're trying already to do something about this fertility research. I think we ought to stop that completely.
What's your question, sir?
That's my question.
You mean, you're asking, do I agree with you that money spent on fertility research...
Absolutely wasted.
And you're talking about research that would enable couples who are facing difficulties achieving a pregnancy.
Yeah, I'm sorry to say it, but yes.
Well, I mean, I understand why you believe that. Having been a person who worked with couples who were desperate to achieve a pregnancy and who want to be parents, it's very hard to say to them, well, we're just not going to be able to help you. I do believe, however, that there is some kind of an imbalance here about how we do spend our money. And
well, you certainly don't approve of the welfare, people on welfare doing the fertility research for them.
Well, the whole welfare thing is another, by the way, issue for us to talk about. But in terms of money being spent on research, I mean, research is going to go on, but I do think society has to look at how we spend our money and where we put our value, where we put our money, and whether it represents the values that we hold. We're just ignoring these problems. But I wouldn't go so far as to say we should just stop all fertility research, because you want parents to be able, or people to be able to choose parenting as well as being able to avoid pregnancy and parenting when they can't carry out that responsibility.
I'm sort of looking around at the house here. With all due respect, Ms. Michelman, it's half empty. I have come here when this place has been jammed, and there were people lining up around the block. And it is appalling that in this day and age, when somebody like you brings out such an important gender issue, important not only for women, but for men as well. Women are underrepresented in the legislatures, in the executive branch, in the judicial branch. As a result, our futures are in the hands of those who don't see the issues as we do. And so this entire thing is very, very tied up, and we must bring this message out in some way. Do you have any thoughts, perhaps, about how we can stop preaching to the choir and start bringing this message out to people who really need to hear it and understand it and get the point that...
I think you could take her on the road, Kate.
Well, even from a financial point of view, it is much cheaper to teach people reproductive care.
That's right.
Than it is to support and work with these underweight babies who are brain damaged, who will constantly cost a great deal of money, who were brought into the world by mothers who weren't really prepared to care for them. How could we get this out? What are we doing wrong? Why can Europe and the rest of the world do it and we can't?
Well, that's a very large question, and I think there are complicated answers. When you talk about, however, let me start with preaching to the choir. I must tell you, our choir is awfully soft, singing very quietly. So I never mind talking to people who may agree with most of what I say, but don't take any action. It's fine for you all to sit here and you may agree with me, you may not. I'm not sure you all do agree with what I've said, but those who do are not motivated to action. If there's one thing I need to do, I don't need to really change anybody's mind on the substance. What I need to do is motivate people to care about these issues and to organize themselves into political action, to change the way things are happening. So I never mind talking to people who may agree with me if I can inspire them. If I haven't inspired you to take some action, to begin to work with groups like us and our affiliate here, Mass Choice, and others who are in Planned Parenthood and others, to really change policy, then I failed. It is a very serious problem. We're not as well organized across the country as the far right is. As I said to you earlier, they are organized to get on school boards, hospital boards, library boards. I have to ask you, maybe I'm in a different kind of audience, but I've asked this question before. How many of you really pay attention to the school board races? Know your candidates, know their positions, know who they are? Very few of you. Most people don't even know who their school board candidates are, let alone have a notion of what they believe. Hospital and library, there are very few, but there are some that are contested elections. They actually run for library trusteeships. Most people don't even know they happen. So somehow the problem we have is complacency.
This picture that Kate described is not a fantasy. Pat Robertson lost and went back and organized and has legions of followers who have training manuals this thick, and they've started at this level, and their goal is the White House.
Oh, there's no question, folks. They did it in 1980, and they will do it again. And I have been challenging some of them on the issue of abortion. I've said, look, if we can agree that we'd like to see fewer abortions, because I'd like to see fewer women have to face the difficult choice of whether or not to have an abortion. Abortion isn't something we're out there advocating women have in order to have a fine experience in their life. That's not what abortion is about. I have 3 daughters. If there's anything I don't want them to have to do is to face that. They may. And if they do, by golly, they're going to have access to a safe and legal one. But abortion is something the society should want to see made less necessary, but not by devaluing women, not by lacking respect for women, not by denying their choice, but by addressing the conditions that cause so many unintended pregnancies. And I can't get the other side to join with me in a very serious campaign on prevention, because many of them oppose sex education. The very same people who oppose abortion don't want sex education. They don't want certain forms of birth control. They don't want people to have access. I don't quite understand it, but it is a fact. And this isn't all of those who oppose abortion, but many. Yes, sir. Sorry.